In 2014, a misdiagnosed case of flu and strep throat quickly turned into a life and death situation for Joy Myers.
Doing what most people do in those type of situations, I was drinking a lot of orange juice, and at the same time my pancreas was shutting down and I didn't realize it, and my blood sugar was going through the roof.
By the time Joy got to the hospital, she was unresponsive. Doctors placed her in a medically induced coma for 9 days until they could figure out what was happening.
Basically, what we found out is that it was adult onset diabetes and type 1, and that I was in ketoacidosis. So essentially, my body was shutting down.
A few blocks away, at exactly the same time Joy was fighting for her life, UAB was announcing a research breakthrough for type 1 diabetes, using a common blood pressure drug called verapamil. Previous research had shown verapamil completely reversed diabetes in mice by lowering levels of a protein called TXNP in beta cells. Eager to prove its effectiveness in humans, the JDRF awarded UAB a $2.1 million grant to test verapamil as part of a 3-year clinical trial. Joy enrolled and would become one of the first participants to take part in this potentially groundbreaking study. She recently wrapped up her first year in the trial. Co-principal investigator Fernando Ovalle says recruiting for the trial is a challenge, in part because type 1 diabetes is often misdiagnosed in adults.
When a patient comes to see me with a diagnosis of type 2 diabetes, 25% of the time it is type 1 diabetes. I'm certainly not saying that 25% of the population out there has type 1 diabetes, but it is not 5%. I think it's closer to somewhere between 10 to 15%.
Back on track to good health, Joy says she regrets not having a primary care physician to visit annually so she could be properly monitored.
That's a regret that I have, and then a piece of advice that I give most people my age and younger, even or older, is if you don't have that person that's doing, a yearly check on you and monitoring, someone that's got your history, maybe she or he could have prevented the emergency situation.
UAB is enrolling patients ages 19 to 45 for the clinical trial. They must enroll within 3 months of their type 1 diabetes diagnosis.
The data that we have for verapamil in animals is super strong. The science behind it is very strong. And now we have a couple of relatively large epidemiologic studies in humans that seem to show the same thing.
Joy doesn't know if she received verapamil or the placebo as part of the trial and won't know for another year. But she says the opportunity to be part of the study has been important for her and her family in helping them learn how to manage and live with the disease.
It provided me with the tools that I need to manage my diabetes. I wouldn't have had that big educational opportunity. I've been taught a lot. I've learned a lot about how to do this and how to manage this. It gives you hope. If not for me, then, hopefully in the very near future we'll be much closer to figuring out this disease and how people can live with it even better or without it at all.
If you believe you qualify, contact UAB today.